I mentioned to you that my background is actually, I used to work for a New Zealand software company from 2010 to 2017 that was an early evangelist and really a world-leading New Zealand company. And we had 3,500 healthcare clients in the United States, half the NHS trusts, every district health board in New Zealand, and half the health service in Australia as customers. And we provided dictation, speech recognition tools. And I remember in 2013, we were at a strategy retreat and we were trying to think about the future of this technology. And we wrote on a whiteboard at the time that our dream was to have the ability to record a patient and a clinician and basically have the notes automatically formatted for that. That was our dream over 10 years ago. At the time, we implemented voice recognition, for example, at Waitemata DHB to roughly 500 clinicians, and I was involved in Europe's largest implementation of voice recognition to Leeds NHS Trust as well, with 1,200 clinicians. And I have to be honest, it was a hard slog. Not necessarily because the tools were not accurate. They were reasonably accurate. There were obviously some mistakes, but between 95 and 99% accurate in transcribing what was said. But the challenge was that basically typically clinicians don't speak in print-ready sentences. And so there was a lot of rework that was required. And this is really the big difference. Now it allows you a multi-speaker audio situation where you can just record a conversation. You don't actually have to dictate your notes, but you can. And the formatting of the results and the ability to take the notes and then refactor it into multiple different formats for different use cases is where the power is, and I'll show them to you in a second. Now, there are a huge variety of these scribe tools. The two most commonly known and used in New Zealand, based on our travels and what we've heard, are Heidi Health and NABLA Copilot. We know that Pinnacle, for example, has already conducted a privacy impact assessment on NABLA Copilot, which I'll show you as well. And there are some considerations that you need to think about when you choose a tool. So, for example, where the data is stored, what some of the terms and conditions are, especially around secondary data usage. So are they able to use the data that you input, for example, for product development, research and development, creating new tools? Those are things to think about, and something that probably as a PHO, you might want to be working with your practices on, rather than every individual practice having to do that for ourselves. It's certainly something that we, as a service provider, are also looking at, providing additional capability. And so NABLA is one of these tools. From what we understand, there's maybe over 500 GPs in New Zealand currently using this technology. It was a French company that then emigrated to the US and is heavily backed by venture funding from the United States. The one tool that has been most used from our conversation in New Zealand is Heidi Health. So I'll start maybe demonstrating Heidi Health, and then I will show you how to do the same thing in NABLA Copilot afterwards. Again, for Pinnacle sites, if you're affiliated with the Pinnacle PHO, our understanding is that your preferred solution is NABLA, and that is because you have conducted a privacy impact assessment, and also there were some lingering concerns with some of the secondary data usage policies that left it open as to how that data is used for Heidi. But Heidi certainly does have a very comprehensive security posture, as well as GDPR compliant, HIPAA compliant, and I can show you some of those trust components as well. But there's an element of due diligence that you need to do. All right, so I'm going to jump straight into Heidi Health. Now, this is you can do this yourself if you go to heidihealth.com. You're just using your normal microphone. In this case, I've selected an option within the settings that allow me to record that I have actually asked the patient for consent and that they've given the consent. And unless I click this tick box, then it does not allow me to start a recording. you can turn that off in the settings, and I will show you how to turn that off. In this case, there's two options to either transcribe, which is about transcribing a conversation between a patient and a clinician, or dictation is where you are basically dictating the notes, but it's a single speaker audio. And what I'll do now is I'll just read a very brief conversation between John, who is there for basically a follow-up diabetes appointment, a regular appointment, and a doctor. And I'll just read both parts because I don't have someone else here with me, but I'll just do that very quickly. Hi, John. How you been feeling since your last visit? I've been really thirsty and needing to use the bathroom more often. I also noticed my vision is a bit blurry sometimes, and I feel more tired than usual. I see. Those can be signs of high blood sugar. We'll check your levels. Last time, your HbA1c was a bit high, so we need to address that. How's your diet and exercise routine? I've been trying, but it's hard to keep up with everything. I haven't been eating as well as I should, and exercise has been on and off. It's understandable. We'll make a few changes to help manage your diabetes better. I'm going to increase your metformin dose and start you on a new medication that can help with both blood sugar control and weight loss. Also, I'll refer you to a dietitian to help with meal planning. That sounds good. I want to get you back on track. Great. So I want to get back on track. Sorry. Great. And try to aim for 30 minutes of exercise daily. We'll recheck your blood sugar in 3 months. If you notice any changes or have concerns, let me know right away. Thanks, doctor. I'll do my best. You're welcome, John. We're here to help you manage this. See you in 3 months. And I'm just going to stop transcribing now. And as you can see, it gives me a couple of options for how I want to structure the note. In this case, I'm only going to be choosing the default general practitioner's note, but I'll go into more details as to templates just a little bit later on. So now the audio has been streamed to the AI, and it is giving me an output. Hopefully that's big enough for you to see. It follows basically a SOAP template, so subjective, objective, assessment, and plan. So the first thing I want to show you is that you are able to actually change the complexity of the note using this voice feature here. So brief will give you more clinician shorthand. So for example, instead of like things like 3 days, it will use 3/7. Instead of a 24-year-old male, it would use 24M. If you use a more detailed or super detailed voice, then that will include more, for example, quotes from the patient conversation. So that can be really useful, for example, for mental health assessments or longer documents. So I might just show you, I'll just click on brief and regenerate the note, and you'll be able to see that it has adjusted that. If I use something like super detailed, it will give me a much more detailed note. And as I've discussed, it does also use more of the patient's voice in there. This brain hemisphere feature right next to the voice, typically keeping it on left is quite useful, especially if it's shorter notes. If you have a very long kind of encounter, then it can be useful to switch it to right. Really what that does is it just takes longer to process, but it can give you better results. Now, once you have this note, you can actually now take this note and create other documents from the note. And now this is a paid feature. Heidi Health is free for note taking, but this basically refactoring the output for something else, for example, a referral letter, requires a paid account. But as you can see, it does that very, very quickly and can be very accurate. And you can actually use the box at the bottom to refactor this note or do anything you'd like it to. So I'm just going to go back to the note. The way that Heidi works is that you can always go back to your note by clicking on note above, and then you can have as many versions of other types of documents that are next to that. And so one of the really, really powerful features, if you combine the 6-step process and tools like Heidi Health, is you can actually make this a really powerful tool to educate patients and to impact things like medication adherence or compliance with treatment plans by explaining what the patient needs to do in language that they can understand and that might be culturally appropriate. So for example, if I've got this particular transcript, what I can do is you can just write on the bottom here, explain to the patient in Te Reo Māori with Te Ao Māori worldview what they need to do. And especially the importance of taking their medication regularly. Okay, so I just hit enter, and now the AI is thinking for me. And just give it about 5 seconds. And now we've got some reo here. Now, I'm not sure if any on the call speaks good te reo and can tell us if it's any good. I certainly don't, but what I'll do is I'll just get ChatGPT to translate it back into English for me. So I'll just put it in there. And so you could just use the same prompts around tone, format, persona to give you better results. But this is can be really, really useful. Also, you might have tourists who are coming into your practice who don't speak English and you need to communicate with them. It's certainly, a really powerful tool that you can use. So, sorry, I'm going to go back to Heidi.
Hey, Florian, there was just one question by Anisha, which is really good. So can the advice be sent to patients via text or email using this tool?
So not directly from the tool. This is probably going back to Tariq's point as well. So what you would do in this case is if you had MedTech, there is actually an integration between a tool like Heidi Health and MedTech that allows you to transfer patient contacts into the tool and then quickly allows you to stream the note back into any template within MedTech. Our understanding is that Industry is looking to develop a similar tool to what we're showing you here, a Heidi tool within Industry itself. So in this case, because we're assuming that you're not integrated, what you would do is you would copy the note or parts of the note, whichever part you want, and you then have to paste it back into your system. And this is where there's a potential for risk. So you, as a clinician, one of the key steps is to obviously check that you are copying and pasting this into the correct patient context by checking the patient label at the top and ensuring that that is correct. Now, in this case, I actually didn't use any patient identifiable information. I could have added a patient name and I could have added more context to improve the accuracy of the AI. In regards to now triggering a workflow, Anisha, to a patient, that you could do that by using the messaging function within your practice management system or copying it into, for example, an email client such as Outlook and then sending it to them. You can also use these tools on your mobile phone. So both Heidi and Nebula are web apps and you can use them on your phone and you could copy this and turn it and then send it as a text message. So at the moment, you're still having to provide the integration. We expect that over the next couple of months, as these tools are more tightly embedded within your practice management system, that you can trigger the end-to-end workflow, including the communication. And certainly, we've heard last Tuesday from providers such as Tend, that obviously have got a more technology-based infrastructure that they are looking to integrate scribing tools, their own scribing tool, into their workflow, and that that is more closely integrated. So this is a very good question, Anisha, and I think I know that one of the people that was going to join the session was the IT support for RAFs, for the PHO. That's probably something that they'll be thinking about as to how to get this most closely integrated into a practitioner's workflow.
Thank you so much. Because I use these bullet points sometimes, like if I'm prescribing a new inhaler or something, and I write in the notes with the like a YouTube link, and I bullet point those things and I send it to elderly patients whom they can't recall everything, whatever we have spoken in the 10-minute consultation over the phone, and I send that via text and with a link of like how to use your new inhaler like Brio or Ellipta, so that even if there is a Muko in their family who can read it out and then show them the video, so that they don't have to come back and ask 100 times like what we discussed and remember everything. That's why I started using like eczema management and stuff and bullet points and sending it to the parents as well, so that they remember exactly when to wean off from the high steroid to the low steroid and when to switch it over.
Oh, wow, that's really, really useful. And Anisha, thank you for sharing that. Actually, I think we'll probably think about this some more because in the future session, we want to look into the application of text to video, which is what's going to be a big feature in the new version of, for example, ChatGPT 5, but also other tools. What does that mean in GP practice? Because in the future, you'll likely be able to prompt and actually create a patient education video from a text prompt. And you could potentially even make the persona in that video look like your patient, so that it is 100% aligned to their environment, and you could add any kind of step that you wanted in there. So I think that's maybe a little bit too advanced for this session today and where the technology is, but within the next 3 to 6 months, it's certainly possible to do.
Yeah, it's moving very fast.
Personalized video education using AI, and you could easily share that with a patient.
Sure. And
So,
if there is anything, sorry to ask so many questions, if there is, because I have some of the very difficult patients over the phone, which I'm dealing for their diabetic education and stuff, they have either the hearing, they can't hear you properly, or some of them are blind who can't read the messages. So is there anything incorporated in this world where we can help the disabled people like who have hearing incapacity or they can't see, if that can be helpful through AI for them?
So Anisha, I haven't got anything prepared, but the answer is yes to both. And what I think I might do is after the session, let us do a little bit of research and then send it to you in detail, but you're able to both, for example, create automatic subtitles for a conversation so that people can read what you're saying on screen. And then secondly, you could easily take these notes and even the translated notes and put it into another tool that will allow you to read it out loud. So for people that can't see, but I need to think through the clinical process a little bit and probably talk to a few people as to what's safe and effective. So I don't want to give you all that advice right now. I do want to think about it a bit more, but I will come back to you, Anisha, on that because it's a really great question.
Thank you.
So I do want to just show you the same type of solution in another tool in Nabla in a second. But before we go there, just a few more things on Heidi that are quite neat. So one is we talked about templates. So you are able to actually generate a template by just typing what you want. So you could say, can you create the referral letter to the dietitian? Because remember, we want to refer this patient to the dietitian. Oh, sorry, I did it the wrong way. I should have actually done it in a different way, but there you go. probably not too bad. Want to change who the dietitian is and the patient name, but that's not too bad. One other thing I want to show you is how to create templates. And again, you can create templates actually by just describing what you want, and it will do that yourself. So, you know, create a mental health assessment, do whatever you want. But if we just want to look at the basic syntax of how it works, and how you could apply this to your GP practice, I'm just going to call this test. The basic syntax in this particular tool is you just write your headings or anything you want in the template, like into the template, and then we have got the square brackets. Anything in the square bracket is for the AI to write into. So you can use just normal language. So and then round brackets are instructions for format or tone. So only include if explicitly mentioned, otherwise leave blank. And then in terms of, if you want something in your template that should always be there, such as a signature block, you just put it in quotes. So for example, and that's how you create a template. And I guess this is probably one where you might want to work as a PHO, or work with you know, a partner like ourselves to help you set up these templates. But certainly it allows for many different ones. And one really powerful feature that was just released 2 days ago is there's actually a community section, and it allows you to get templates by location. In this case, it's only been out for two days, but you can sort them and you can share your own templates, and you do get recognition for being the creator of a template. I guess you don't get paid, but at least there's a little bit of kudos for contributing to the community. So what I'll do is I'll just switch tools now. I'm going to switch from Heidi Health to Nabla. And what I've done is I've just dictated the same note that I've done, and it's already in here, so I'm not going to do that again. But I'll just show you how this tool might be just slightly similar. So you can see it's structured in a similar way, it looks similar, but I'll just show you how to do kind of the same thing as we did in Heidi, now on Nabla. So one difference is that Nabla actually gives you the whole transcript. You don't typically have that in Heidi. And then the way that the templates work is slightly different. So I'm just going to show you. So basically, the template is selected here. It's very similar to the way that it works in Heidi, but there's a little bit more complexity to creating your particular format and style, but you certainly can set all this up beforehand so that it's quickly set together, and it's kind of drag and drop. You can pull the different parts that you need into your note template, and then you can easily regenerate. The magic edit is similar to the Heidi Health Ask Me Anything box. So this is where you can use your knowledge from the 6-step process to ask the note to be changed in whichever way you like. So in this case, you could get to rewrite the note in another language, or you could make it more concise, or you could include more patients. So for example, if you write include more patient commentary in quotes, and I regenerate it, that works really similarly to the voice feature within Heidi Health. So this magic edit function can be really, really powerful, and you can use the same techniques that you've learned in the 6-step process here to turn this note into whatever you need. The other cool feature is if you have taken a note and it's gotten the patient pronouns wrong, you can change that here, and you can always regenerate. One other cool feature is just at the bottom, you've got this patient instructions field. So these are pre-formatted for patients and parents, just with the highlights of the note consultation and the instructions as to what needs to happen. In this case, it's still regenerating this, but that can be very, very useful. So Anish, you can see that this would be quite simple for you to then, for example, forward to either a patient or the parents of a patient, and all you have to do is just copy that. And you can also generate a PDF to send out. And the way that you turn this, for example, into a letter is a little bit hard to find, but just on the bottom there where it says copy note, there's a little downward arrow. So if you click on that, you can actually generate a letter by clicking on this button. You add a few, I'm just going to call him John Doe, and it's going to be Dr. Smith, who's the receiving doctor, and I'm not going to put anything in here. But you can see this one is pretty, it doesn't actually reformat it as much as Heidi Health. It just copies the components of this into a letter for you. So that one is quite useful. One other thing I wanted to share is when you click on a new encounter, for you, Anish, you have this encounter type within Nabla. So one is in-person video or phone call. And then what that allows you to do is it actually aligns the AI a little bit for the audio quality that it expects. So that can help with improving the results. It's just a minor difference. But one thing that does help is if you would like, you can add additional patient context that you could, for example, copy and paste from your practice management system. And you can do the same thing in Heidi Health.
Hey Flo, just one other question in the chat box.
Yeah,
how long can we use editing after the consult?
Yeah, that's a great question. So within Nabla, Nabla saves encounters for 14 days. You don't have any option to change that from what I understand. So after 14 days, this is gone. And if you're looking into both these tools, there is no way for you to play back the audio. So you cannot access the audio in either of these tools again. It's only the output from the AI that you've got access to, but the AI remembers what was recorded. So within Heidi Health, I'm in Heidi Health now. If you go to settings, apologies, it's under account now. I think it's changed a little bit. Hold on. I think they've just changed this a couple of days ago. So I think it's now under preferences.
Wondering if it's in preferences, yeah.
Yeah, it's under preferences. Under data management, you have the setting here, automatically delete consult either never, or you can set the retention period between 1/7/21 or 90 days. In this case, it's set to never delete. And so this is also a new function to actually be able to store recordings of the dictation. So by default, this is off. So it's quite interesting. These things actually move very quickly. When we presented this last week, this feature was not in the solution. So now you can actually store recordings, but by default, it does not store recordings. It only stores the note and the transcription results. Now, from what you've seen so far, obviously it has been reasonably accurate, but I want to show you just an example. Sorry, not this one. Just an example that we presented the other day. And granted, this is a hospital-based scenario, because obviously if someone were to present at your GP clinic with chest pain and shortness of breath, you would send them to the hospital. But I just wanted to show you how tricky it might be for you to spot some of these errors. I especially remember Jan's comment from the beginning where you spoke about, will it save me time because I need to think in a certain way. So I might give you guys 20 seconds to review what's on the left hand, which is what was in this case dictated into the solution, and then on the right hand side what Nabla has created as a note for us. Are you able to spot any mistakes, any issues? I'll just give you a bit of time to think, to look at it.
You're more than welcome to unmute yourselves and see if you can pick up that error. Modi order.
Anyone?
The current medication is not correct, is it? Or is it? It's a bit confusing how it's laid out.
1 gram Tylenol, which is paracetamol, PO at 800 hours.
I guess current medications in my mind would mean what the current medication that the patient is on regularly, rather than.
Yeah, you're absolutely right. So that's one. Actually, this is it has been administered, but that's not necessarily all their current medications, which is correct.
And the pain, I would add, it says 6 out of 10, and then pre-meds 3 out of 10.
Perfect, you're spot on. Yeah.
Yeah, this is actually this is the one that we spotted as well. So full marks for both of you. So yes, obviously in a hospital context, imagine you would have given pain medication and the pain score has actually increased. That would obviously be a something to be really concerned about. But in this case, it just didn't get it right. And so that is a very good example. We've had another person pick up also that instead of type 2 diabetes mellitus at the top there, it actually says 2DN, which typically is a shorthand for district nurse. So it can and it will make mistakes. And there is actually a cognitive bias. There's a different kind of cognitive burden on a clinician to review the results that you need to be mindful of. I think for all of us, whether we're clinicians or not, we can understand this type of bias. If we recollect maybe reading an email that we sent a week ago, suddenly now we can see all the mistakes that we've made, the doubling up of words, the mispunctuation, the misspellings, the incorrect word endings, the wrong words that we use. We didn't see it the first time when we wrote the email, because we always see on screen what we thought we said or what we think should be there. We don't always see what's what actually is there. So what actually should be there. So that's where it can be a little bit tricky, especially if you can't replay the audio. So maybe for some of you that also have got support. I know that some of your GP practices, the notes are obviously dictated by the clinician, but you have support where someone else is actually reviewing that for you. And that might be a good step that you could implement. But just if you are by yourself, just make sure that you do check the notes and that you check that you're pasting it into the correct patient record if it does have a copy and paste step in there. Because as we mentioned, it is still your responsibility, even though you're using a tool to make your life easier. Ultimately, the correctness, comprehensiveness, and clinical appropriateness of the note or any patient instruction is obviously down to you as the clinician.